We're going to be a little silly today. We're going to talk about neck comfort and neck movement, and I have a sort of unusual model here today. The thing that came to mind to best represent the movement in the neck is a stack of pancakes. So bear with me. With car accidents, with injuries, with chronic stress, the neck muscles can get very tight, and then eventually you get your mobility back, but lots of times you don't get the full flow of movement back, and you ongoing have tension and pain in the neck that's difficult to resolve. So massage is often helpful, or hands-on therapy. Sometimes stretching is helpful, but when you do those things and the pain keeps coming back, then we need to think a little bit about how to get normal sequencing of movement to come back to the neck. Now, I'm leaving out of this picture that we're talking about today things like a herniated disc in the neck that's pinching on a nerve that's giving specific kinds of problems related to that. We're talking about chronic muscle spasm and chronic muscle tension in the neck. So that's the focus here. So one of the concepts for restoring comfort when we're thinking about rehabilitation is to restore normal regional movement to an area. So all the possible movement links are participating in the movements that you ask your body to do, instead of you getting like skips in the movement sequences. Those skips in the movement sequences are the areas where your muscles are chronically tight and don't contribute to fluid motion. So what we're trying to restore is fluid movement, and Gumby is my little hero, because the idea is that you have all of these kinds of movement that's free and easy without restriction. Let's take a look at how this might work in the neck. Alrighty, now we got the head. Okay, so the main movement of the head on the first bone in the neck is that. It's called yes. It's kind of like the head moves on like a rocking chair a little bit on this sort of a pivot. And there's two places at the bottom of the head that connect with the first bone in the neck, and it gives this kind of action. Now, that's the main movement there, but there are also other movement sequences. They're very subtle, and they're pretty small motions, and that is this kind of a slight tip to the side, like that. Teeny little bit of tip, like when your dog sits there and cocks its head at you. So I modified my Pez today, and Tigger's going to demonstrate a little bit for us. We'll just lengthen his neck out. Okay, so again, this is this action here. Now Tigger's head is on a pivot, so he can't really demonstrate that rolling action, and he's on a pivot, and so he doesn't have any of the side bending. And sometimes what will happen when you start checking your own neck is you'll have side bending one way, and you won't be able to get side bending the other direction. So what we want to think about with your neck is how to regain movement at the very top of the head and the neck. So what I want you to do for starters is you take your fingers and you place them behind your ears, kind of just under the ear. There's a pokey, sore place there if you kind of drill in. That's the side of the first bone of the neck. It has wide pieces. So you can put your fingers in this area, and you don't have to hurt yourself. So if you put a little extra muscle there, you'll be more comfortable. And if you'll just sit and support your head a little bit, then you'll start to get a feeling for the first bone in the neck. When they take an x-ray of the head on the neck, the person opens up their mouth and they take a shot right through the mouth, because this bone is sitting about on level, way up here. So the jaw is coming down in front of it. So you hold on to that bone a little bit, and then just tip your head a little and feel how you can get that rocking movement. Okay? And most people have a certain amount of this rocking movement. And where some of the distinctions come for lack of movement is if you support here and then ask your ear to come down a little, just a teeny little bit. I'm going towards my right and I'm going towards my left, and I can't go left as easily. It's like I'm blocked. I can go much easier to the right. So if I was trying to rebalance the muscles around my head and neck, I might want to start at the very top, and I might want to just engage the muscles on that left side a little bit, like I'm cocking my head to the left a little. So just to, not this much, because that's happening lower down in the neck, but just a teeny little bit. And then I might want to go on about my business while I'm holding my head slightly to the left. And then I'll eventually forget about it, and I'll go back to however I normally am. But then when I think about it again, if I'll just say to myself, oh, make that slight little tip, then go on about my business and try to kind of keep that holding there, it'll start to retrain this movement pattern that the head can tip to the side, and that the muscles over here on the left side can close a little bit and engage activity there. The opposite side then has to lengthen out. So on my pancake stack, let's go back there and see whether we can get that to happen. Alrighty, here's my pancake stack. Hopefully it's, I'll lower the camera a little. Hopefully it's not under too much glare. I'll see if I can zoom in. Okay, so there's my pancake stack. And you have to imagine that there's all different kinds of muscles off to the side, big long muscles that cross many joint levels, and then a bunch of little muscles that only cross one joint level. And so normally, normally there's a certain amount of tension in the muscles that kind of creates a little bit of compression and holding, and so that when one side engages and squeezes down a little more, the other side is clued through the hard wiring of the brain to lengthen and let you bend over this way. And basically, you can get this stack of bones, the neck, and then on down into the upper rib cage, to bend lots of different directions. You can curl forward, you can go to the side, which is often a very limited movement for people, and you can get a curve to the back. If there's chronic muscle spasm, I kind of visualize that like let's say you got a clothespin, and it's like you got a pinch going on there. So for me, I can't tip my head to the left as well. I probably have a little bit of a, we'll switch sides. I probably have a little bit of a extra tension going on the right side that I have to fight against all the time. So by making a habit of periodically engaging these muscles, that's one way to start to reprogram the system to come back to an even set of balance here. Ideally, we'll bring the head back in and zoom out a little. Whoops, other way. I've got to move the camera. So ideally, my head will be in the middle of my body, and all these segments will also be in the middle, and they'll have even and balanced activity from one side to the other. That's just a thought about getting some regional movement in the neck.